Micardis is a medication used to treat high blood pressure, also known as hypertension. By lowering high blood pressure, Micardis can help prevent strokes, heart attacks, and kidney problems. It belongs to a class of drugs called angiotensin receptor blockers, ARBs, and works by relaxing blood vessels, making it easier for blood to flow. The usual starting dose is 40 mg once daily. It can be taken with or without food, but it's important to take it at the same time each day. It's best to take Micardis at the same time every day to help you remember. Always take Micardis exactly as your doctor has told you. Before starting Micardis, make sure to read the patient information leaflet from your pharmacist. Take this medication by mouth with or without food as directed by your doctor, usually once daily. The dosage will be based on your medical condition and response to treatment. It's important to take this medication regularly at the same time each day to get the most benefit from it. Even if you start feeling well, continue taking Micardis as prescribed. It may take up to 4 weeks before you notice the full benefit of the drug for the treatment of high blood pressure. If your condition does not improve or worsens, such as if your blood pressure readings remain high or increase, make sure to consult your doctor. As your body adjusts to Micardis, you may experience dizziness or lightheadedness. If these effects persist or worsen, inform your doctor or pharmacist. To reduce the risk of dizziness and lightheadedness, get up slowly when rising from a sitting or lying position. It's important to remember that this medication has been prescribed to you because the benefit outweighs the risk of side effects. Many people using Micardis do not experience serious side effects. However, it's crucial to notify your doctor immediately if you experience fainting, symptoms of high potassium blood level, or any signs of kidney problems such as a change in the amount of urine. While rare, a serious allergic reaction to this drug is possible. Seek medical help if you notice any symptoms of a serious allergic reaction, including rash, itching/swelling, severe dizziness, or trouble breathing. This is not a complete list of possible side effects. If you experience other effects not listed here, contact your doctor or pharmacist. Remember to consult your doctor for medical advice about side effects and to report any side effects to the appropriate health authority in your country. If you are a woman of childbearing age, it is important to use reliable forms of birth control while taking Micardis to prevent pregnancy. If you are planning to become pregnant, already pregnant, or think you may be pregnant, it is crucial to inform your doctor immediately. Taking Micardis during pregnancy can cause serious harm to an unborn baby, and it is important to discuss this with your doctor to ensure the safety of both you and your baby. Before taking Micardis, make sure to inform your doctor or pharmacist about any allergies you may have, as this product may contain inactive ingredients that can cause allergic reactions. Also, let them know about your medical history, especially if you have liver disease, bile duct blockage, high potassium levels in the blood, or if you are dehydrated. This medication may cause dizziness, and alcohol or marijuana can make it worse. It is important to avoid driving, using machinery, or doing anything that requires alertness until you can do so safely. Limit alcoholic beverages and talk to your doctor if you are using marijuana. Excessive sweating, diarrhea, or vomiting can make you feel lightheaded. If you experience prolonged diarrhea or vomiting, it is important to report it to your doctor. Additionally, this product may increase potassium levels, so it's important to consult your doctor before using potassium supplements or salt substitutes containing potassium. Before undergoing surgery, make sure to inform your doctor or dentist about all the products you are using, including prescription drugs, non-prescription drugs, and herbal products. If you are pregnant or planning to become pregnant, it's important to talk to your doctor about the risks and benefits of using Micardis, as it may harm an unborn baby. It is also unknown if this drug passes into breast milk, so consult your doctor before breastfeeding. It's important to be aware of potential drug interactions with Micardis, as they can change how your medications work or increase your risk for serious side effects. Make sure to keep a list of all the products you use and share it with your doctor and pharmacist. Do not start, stop, or change the dosage of any medicines without your doctor's approval. Some products that may interact with Micardis include aliskiren, lithium, and drugs that may increase the level of potassium in the blood. Additionally, some products have ingredients that could raise your blood pressure or worsen your heart failure. It's crucial to tell your pharmacist what products you are using and ask how to use them safely, especially cough and cold products, diet aids, or NSAIDs such as ibuprofen or naproxen. If you suspect an overdose and observe serious symptoms like passing out or difficulty breathing, it's important to seek immediate medical help. In the U.S., you can call your local poison control center at 1-800-222-1222. Canadian residents can reach out to a provincial poison control center. Symptoms of overdose may include a rapid heartbeat, severe dizziness, and fainting. Remember not to share Micardis with others. It's important to have lab and/or medical tests, such as kidney function and potassium levels, while taking Micardis. Make sure to keep all medical and lab appointments and consult your doctor for more details. Lifestyle changes, such as stress reduction programs, exercise, and dietary changes, may help Micardis work better. Talk to your doctor or pharmacist about lifestyle changes that might benefit you. Make sure to have your blood pressure checked regularly while taking Micardis. It's also important to learn how to monitor your own blood pressure at home, and share the results with your doctor. If you forget to take a dose of Micardis, take it as soon as you remember. If it's almost time for your next dose, just skip the missed one and take the next dose at your regular time. Don't take a double dose to make up for the missed one. When it comes to storing Micardis, it's important to keep it at room temperature, away from light and moisture. If it comes in a blister pack, only remove the medication right before using it. If it's in a bottle, make sure to keep the container tightly closed. Avoid storing it in the bathroom and keep it out of reach of children and pets. When it comes to getting rid of Micardis, it's important not to flush it down the toilet or pour it into a drain unless specifically instructed to do so. Instead, properly discard the product when it's expired or you no longer need it. You can consult your pharmacist or local waste disposal company for the best way to do this. If you need more help, call your doctor for medical advice. In the U.S., you call FDA, 1-800-FDA-1088. In Canada, you may call Health Canada, 1-866-234-2345. Wishing you good health. Thanks for watching.